Huntington's disease is a rare and devastating genetic condition that affects the brain, causing a progressive breakdown of nerve cells. This condition leads to a wide range of physical, cognitive, and psychiatric symptoms that worsen over time. The condition is named after George Huntington, which is the American physician who first described it in 1872. At its core, Huntington's disease is caused by a genetic mutation in the huntingtin gene, which provides instructions for making the huntingtin protein. This protein plays a crucial role in nerve cells, particularly in the brain. This genetic mutation involves an abnormal repetition of a specific DNA sequence, called CAG, many more times than usual. This unnecessary repetition of DNA leads to the production of an abnormally long and toxic version of the huntingtin protein. This toxic protein then accumulates in brain cells, disrupting their normal function and eventually causing them to die. The number of repeats plays a crucial role in determining whether a person will develop the disease, and if so, at what age the symptoms will begin. People with more than 40 CAG repeats in the huntingtin gene typically develop Huntington's disease. Those with 36 to 39 repeats might or might not develop the disease, while those with fewer than 36 repeats do not develop HD. The prevalence of Huntington's disease varies across different populations. In Western countries, it affects approximately 5 to 10 individuals per 100,000. However, some isolated populations, such as the inhabitants of the Lake Maracaibo region in Venezuela, have a much higher prevalence due to a founder effect. In contrast, the disease is relatively rare in some Asian and African populations. Types of Huntington's disease. Huntington's disease is generally classified into two main types based on the age at which symptoms begin. Number 1. Adult-onset Huntington's disease. This is the most common form of HD, where symptoms typically begin between the ages of 30 and 50. Adult-onset HD progresses over 10 to 25 years, leading to increasing disability and eventually death, often due to complications such as pneumonia, heart failure, or infections. Number 2. Juvenile Huntington's disease. This less common form of the disease occurs in individuals under the age of 20. Juvenile HD progresses more rapidly than adult-onset HD and is often associated with additional symptoms such as seizures and stiffness in the limbs. The disease typically progresses over 10 years or less. Causes of Huntington's disease. The cause of Huntington's disease lies in genetics. It is an autosomal dominant disorder, meaning that a person only needs to inherit one copy of the defective gene from either parent to develop the condition. If a parent has Huntington's disease, each of their children has a 50% chance of inheriting the faulty gene. This pattern of inheritance makes Huntington's disease particularly devastating for families, as multiple generations can be affected. The genetic mutation responsible for Huntington's disease involves an expansion of a CAG trinucleotide repeat in the huntingtin gene. In unaffected individuals, this CAG repeat occurs 10 to 35 times. People with Huntington's disease typically have 40 or more CAG repeats. The number of repeats correlates with the age of onset and severity of the disease. Generally, the more repeats, the earlier the onset and the more severe the symptoms. Still, the exact mechanism by which the abnormal huntingtin protein causes nerve cell damage is not fully understood. However, it is believed that the protein interferes with various cellular processes, including the regulation of gene expression, protein degradation, and energy production. Over time, the cumulative effects of these disruptions lead to the progressive degeneration of nerve cells, particularly in the basal ganglia, which results in the characteristic symptoms of Huntington's disease. Symptoms of Huntington's disease. The symptoms of Huntington's disease can vary widely from person to person, depending on the age of onset, the number of CAG repeats in the huntingtin gene, and the rate of disease progression. However, the disease generally follows a predictable course, with symptoms gradually worsening over time. The symptoms of HD can be grouped into three main categories: motor symptoms, cognitive symptoms, and psychiatric symptoms. Number 1. Motor symptoms. Motor symptoms are often the most noticeable signs of Huntington's disease. These include chorea, which are involuntary, jerky movements that can affect various parts of the body. Patients might appear restless or fidgety, with movements that look like dancing. As the disease progresses, individuals may also experience dystonia, which are involuntary muscle contractions that cause abnormal postures. Some people may also have slow, unusual eye movements. Other motor symptoms include problems with balance, difficulty swallowing, also called dysphagia, and changes in speech patterns. In the later stages of the disease, individuals may become completely dependent on others for their care. Number 2. Cognitive symptoms. Cognitive symptoms of Huntington's disease can be subtle at first but become more pronounced over time. Patients often experience difficulties with concentration, planning, and problem solving. They may struggle to learn new information or multitask. As the disease advances, memory problems become more severe, and patients may have trouble recognizing family members or navigating familiar environments. Number 3. Psychiatric symptoms. Psychiatric symptoms are another significant aspect of Huntington's disease. Depression is common, affecting up to half of all patients. Other psychiatric symptoms can include anxiety, irritability, and apathy. Some patients may experience personality changes, becoming more impulsive or developing obsessive-compulsive behaviors. In more severe cases, patients might experience psychosis, including hallucinations and delusions. Diagnosis of Huntington's disease. Diagnosing Huntington's disease typically involves a combination of clinical evaluation, family history, and genetic testing. A neurologist will usually perform a detailed physical examination, looking for characteristic signs of the disease such as involuntary movements or changes in reflexes. They will also assess cognitive function and inquire about any psychiatric symptoms. A family history of Huntington's disease can be a strong indicator, given its inherited nature. However, in some cases, there may be no known family history due to misdiagnosis in previous generations or the early death of an affected parent before symptoms appeared. The definitive diagnosis of Huntington's disease comes from genetic testing. This involves a blood test to analyze the huntingtin gene and count the number of CAG repeats. A result of 40 or more CAG repeats confirms the diagnosis of Huntington's disease. For individuals with a family history who are not yet showing symptoms, predictive genetic testing is available. However, this decision is deeply personal and often involves genetic counseling to discuss the implications of the test results. Treatment for Huntington's disease. Unfortunately, there is currently no cure for Huntington's disease. Treatment focuses on managing symptoms and improving quality of life. For motor symptoms, medications such as tetrabenazine or deutetrabenazine can help control chorea. Antipsychotic drugs may also be used to manage involuntary movements and can help with psychiatric symptoms as well. Other than that, physical therapy can help maintain mobility and prevent falls, while occupational therapy can assist with adapting to physical limitations. Cognitive symptoms are more challenging to treat directly. However, strategies can be employed to help patients cope with cognitive decline. This might include using calendars, lists, and other organizational tools to manage daily tasks. Speech therapy can help with communication difficulties and swallowing problems. For psychiatric symptoms, antidepressants, anti-anxiety medications, and mood stabilizers may be prescribed as needed. Psychotherapy can also be beneficial in helping patients and their families cope with the emotional impact of the disease. In addition to symptom management, supportive care becomes increasingly important as the disease progresses. This might include assistance with daily activities, nutritional support to maintain weight, and eventually full-time care in advanced stages of the disease. At the end, it's worth noting that research into potential treatments for Huntington's disease is ongoing and offers hope for the future. Current areas of investigation include gene therapy approaches aimed at reducing the production of the mutant huntingtin protein, as well as strategies to enhance the brain's ability to clear the toxic protein. Some clinical trials are actually underway to test these and other potential therapies. Now, we want to hear from you. If you've undergone genetic testing for Huntington's disease, how did you make the decision, and what advice would you give to others considering it? Share with us your experiences and opinions in the comments below. We love to hear them. Thanks for watching.